Good morning, afternoon, or evening, and welcome to the Global Heart Hub Unite Annual Summit second day and today's focus on session in heart failure, where we will talk about the optimal care pathway. My name is Aista Sharaite, and I will be moderating today's session, where we will talk in depth about what can stakeholder. In today's session, we have three great speakers who will share their perspective and expertise. And I would like to welcome Professor Dr. Eva Anita Jankowska, an expert in heart failure, as well as cardiologist and geriatrician from Poland. Dr. from United States, and Dr. Gillian Coate, the co-founder and president at HeartLife Canada, and a director of the Alive Research Lab at the University of British Columbia, Canada. At the end of this Focus On session, we will have the Q&A, and I would like to encourage all the viewers to ask the questions to our panel. You can do so by clicking on Q&A middle icon on your right side next to the chat. With no further ado, I would like to start the discussion on the optimal care pathway in heart failure, directed from the clinical perspective. And I would like to ask Professor Jankowska and Dr. Prasoon to join me in this discussion. I would like to start with the question directed to Dr. Prasoon. What would you say is the ideal heart failure patient care pathway from the nursing perspective?
I believe that the ideal pathway really involves patients and their engagement. Coming to a clinic to be evaluated and being able to understand and appreciate their signs and symptoms, and to be able to articulate those symptoms to the provider, which will then allow further evaluation and assessment. So I really see patients as a partner in this whole process of moving forward for that optimal care.
Okay, that's very great. And I would like to move to Professor Jankowska and see if she has anything to add from cardiology perspective. So what would be the ideal heart failure patient care pathway from your perspective?
Something which I think is extremely important to identify the management of the patients with heart failure as a teamwork. So definitively, we need to work together. It's not just cardiologists and nurses, but also people who are very important are general practitioners, physiotherapists, dietitians, and psychologists. And something which I think works in many European countries is the establishment of the coordinating nurse, which helps the patient to contact with other healthcare professionals. And this is based on the heart failure nurse clinic. And I think this is something extremely well working in many countries.
Okay, perfect. We always say as the patients that, the nurses are like in between of this connection along together with the doctors. So they have the closer relationship with the nurses who are like one of the key points in that multidisciplinary team where you have your care and you can better manage it. I would like to go into the second question that I have, and we'll talk about what society has to know about the heart failure. And I would like to direct that question talking from the prevention and recognition and what patients need to know. So the question kind of directs into two perspectives: what society in general needs to know and what patients already living with heart failure needs to know. And I would like to go to Professor Jankowska again and hear her response to that.
I would like to say that the lay people need to know what heart failure is, that what are the major symptoms which occur particularly in the de novo setting of heart failure, because something very important is to identify patients with, let's say, presumed heart failure as soon as possible. Talking about the dyspnea, people in current era, people link chest pain with the acute MI and further consequences. We need to increase awareness, showing that dyspnea is also an important symptom, especially resting dyspnea, maybe the reflection of the heart failure decompensation, which also is very threatening disorder. We also need to let people know that heart failure is an ominous disease, unless it is treated. But the message to people should also be positive. In current era, heart failure can be prevented and can be treated, provided we implement several important measures to do so.
Perfect. I totally agree with that. And I would like to just move to Dr. Prasun and see what would be your outcome from the nursing perspective. Would that what the society and the patients need to know? It differs in a sense what Professor Jankowska said.
No, I concur with what she has said. I also think that with greater awareness, just as a compliment to her comments, I think with greater awareness and society at large, recognizing and identifying, when you currently say the word heart failure, that term in and of itself, causes one to pause. And I really think that by increasing awareness that failure really does not have to be the end outcome, that by looking at risk factors, recognizing and being proactive in our heart health, it is so critically important. I think the other piece of that is, again, recognizing those signs and symptoms. Many times over, I have had patients tell me, yes, I've gained some weight and my legs have been swollen and I've had abdominal distension or swelling that has occurred with increasing shortness of breath that has gone on for a period of time. And they have difficulty associating that with heart failure. And so, again, I think early recognition of those symptoms and prompt treatment is critical, but I also feel very strongly about the importance of raising awareness very broadly with society.
Absolutely, couldn't agree that. And awareness is the start of everything, and that's what I say with my community and myself being a patient, saying knowing the symptoms and knowing how to express to the doctor and seeking that help on time is very, very, very crucial. But what Dr. Prasun has mentioned as well about the risk factors, and that's what I want to come back to you with this question about what are the major risk factors in heart failure? What would you highlight from the nursing perspective?
I think first and foremost, again, is if you have a history of cardiovascular disease, such as a heart attack in the past, that should be, a point at which one should pause and really take a close assessment of your lifestyle and making those corrective changes and taking medications as prescribed. Secondly, I believe good, tight blood pressure control. Many times, I have seen individuals that their blood pressure has been on the higher end of readings, the 140, 150 on that upper number. And tighter control is so very important. By taking corrective steps, tight control of your diabetes if you're diabetic, but taking those important steps to prevent going down the pathway of ultimately developing heart failure, I think is key. So,
absolutely. And I would like to come to Professor Jankowska and again talk about the risk factors. Would you have anything to add in terms of what do patients need to know in terms of the risk factors in society, what they need to pay attention to kind of, prevent to develop the heart failure in the future?
Yes. we know that let's say, two major diseases that lead to heart failure are hypertension and coronary artery disease. Therefore, we need to put all our efforts to treat these diseases efficiently. But we also have to be aware that we cannot completely prevent heart failure. We have to do our best. But there are also other diseases, other problems that at the moment are quite dreadful and may lead to heart failure. One of them is diabetes. And we are quite lucky that there are anti-diabetic drugs that have shown to prevent development of heart failure. And that's why these drugs should be considered as the first-line treatment. This is extremely, extremely important. The second disease is chronic kidney disease. And again, in recent years, we have, as cardiologists, as physicians, we have implemented therapies that have been shown again to prevent heart failure using certain drugs in chronic kidney disease. And on the other end of this problem, we have other factors that lead to heart failure, like drugs, especially in oncology, like different toxins. People expose themselves to different medications, which are extremely toxic. And the problem that we have been dealing quite recently are myocarditis, that in some cases in young and middle-aged people may lead to heart failure. And the prime example is, for example, myocarditis due to a COVID-19 infection. So this is also something that we should be aware. So there are many, many diseases, and usually they are to some extent age-specific. Myocarditis, toxins are usually typical for relatively younger people. But if you look at the diabetes, which is let's say the pandemic currently, this problem is very important. And we need to be aware that there are really effective treatments which can prevent heart failure.
Absolutely. I couldn't agree that as well from the patient perspective of the importance of how it is important for me was when I was going from the different stages of like living with a left ventricle assisting device and then now being transplanted of the importance of the vaccines, actually going and taking every vaccine possible to block any possibility of having any virus and develop any complications for the organ and for the heart especially. So that is very important, absolutely, from the patient perspective. But let's talk about the timely diagnosis. Working as a patient advocate, in general, participating in different summits and conferences, we often hear about the term of timely diagnosis in heart failure. And I would like to ask actually both of you, and I will come back to Dr. Pursoon, what does it mean and how it is important for the patients?
Timely diagnosis is truly critical because if the longer a patient goes without proper treatment, the further decline one could experience. And so really being diagnosed early on is critical because it really lends itself to improved outcomes. As has been stated, there are excellent treatments out there for heart failure that save lives, that improve outcomes. And so by experiencing an early diagnosis, it really can have a tremendous impact on the overall outcome. With that being said, again, I think this goes back to raising awareness. So the individuals recognize that something is awry with regards to symptoms, and being able to communicate that clearly with your provider to where steps can be taken, I think are critical. More recently, there was an approved universal diagnosis of heart failure, which I think has lent itself to clarity with really serving to facilitate that diagnosis.
Perfect. And I would like to move to Professor Jankowska and see her perspective on the timely diagnosis.
This concept of timely diagnosis, again, relates to the increasing awareness regarding the symptoms that may reflect heart failure among the patients, among the lay people that may have heart failure, and they should be aware that, for example, this exertional dyspnea may be a reflection of heart failure, that peripheral edema may also be cause of heart failure, that cough. For example, many patients are treated with antibiotics with the diagnosis of pneumonia, whether this is just the pulmonary congestion, and this is also something we also should let's say better educate, I think, our colleagues in extra cardiology world, I would say that pulmonologists, intensive care medicine, but also general practitioners who are at the first line. And I have to say, I'm really aware that the GPs are in a very difficult situation because they need to cover a lot of details coming from different branches of medicine. Therefore, I think that the message from cardiology world to them should be extremely pragmatic and simple, but also emphasizing that in many cases, the heart failure can be diagnosed. I would like to mention one thing, because in the recent year, there is a revolution regarding the treatment of heart failure with preserved ejection fraction. For the first time, we have the drug that saves lives in this group of patients. And the diagnosis of heart failure with preserved ejection fraction should usually occurs in internal medicine world, in geriatricians, is related with among elderly, obese people, and this problem is completely neglected. And what we can say, 50% of patients with heart failure have heart failure with preserved ejection fraction. And this is as an example of area which definitively needs to be developed and promoted really, really broadly.
Absolutely. And it needs more awareness as well about that. So it absolutely is one of the important things as well. And second hand, what Professor Jankowska just said, like even in my experience being as a patient, being as a responsible one, when I felt the symptoms, I was knocking on the doctor's office, like bi-weekly basis, and what I only got was the treatment for the symptoms. So not having my diagnosis on time actually led to me reaching the heart failure at end stage and being diagnosed with ejection fraction being only at 10%, where within a month my symptoms worsened like extremely. And if it could possibly been diagnosed earlier, then I know probably my outcomes were a little bit different. But let's talk about the symptoms now. And I know both of you have touched that. So recognizing the symptoms is not enough anymore. So how patients need to self-observe and know when to seek help. And I think that's a very important question as well for the patients, because when we feel sometimes say, oh, we don't want to bother the doctors, maybe it will go away, which is not the case sometimes as being the patient and a heart failure patient. But what would you say and recommend from your clinical perspective? And I would come back to Professor Jankowska.
If we speak from the patient's perspective, I think, and something that we teach patients is to, for example, everyday monitoring of the body weight. This is really critical. There is simple measure. Patients as getting up and before, drinking, eating, taking drugs, is measuring his or her body weight. Extremely, extremely important. Very simple, very pragmatic. Measuring blood pressure, heart rate is also something very important and can help us to obviously identify side effects of the drugs and other complications. And on the other side, we also should recommend regular, maybe not very frequent, but sometimes measuring some critical laboratory measures like serum creatinine, potassium, sodium, extremely important, and magnesium, and also hemoglobin level, and to some extent also iron parameters. But monitoring creatinine and potassium is very important in the context of the treatment that we apply in patients with heart failure.
Okay, perfect. Very, very good few points. And Dr. Bressoon, would you have to add anything of, how patients can better self-observe and when to seek help?
I think it's a matter of really knowing yourself. I concur with the comments that have been made, but in addition to that, I think it's those subtle changes that patients need to recognize. And if they're really monitoring their self, they're able to identify those subtle changes, such as if you normally sleep lying flat in bed and suddenly you need one or two pillows to get comfortable, that's one of those subtle signs of, something's changed here. Likewise, if when you bend over to tie your shoes, if normally that's not an issue, but suddenly, I'm a little winded. Those are the things. Or if I normally go for a walk and I walk a block without any trouble, and then suddenly, I have to pause for a minute, or I've slowed my gait down to where I'm walking slower. Again, I think those are the subtle things that by doing that daily self-assessment, you're able to identify. And so you have to ask yourself, has something changed? And if something has changed, then that really should be a trigger of, I need to pay attention to this, what has occurred here, and maybe I should make a phone call.
Absolutely. I know, now in the nowadays living is such a busy life and everyone is so busy. It's so important sometimes just to stop and, recognize yourself and how you feel. Even simple thing as Dr. Prasoon has mentioned, tying your shoe. If there is this challenge for you, it means something is not right. So you need to seek help. So these little things, they really are very important. So stopping and really paying attention to yourself and how you feel, I think that's as well, they're very, very important. And what Dr. Prasoon has mentioned about, self-management of it. And we talk about the patient responsibility. So patients being responsible of, how they feel, of taking care of their symptoms and signs and tracking everything, taking their medications as well. So talking about the self-management, would you think are the vital signs that patients are responsible to monitor on a daily and weekly basis, and how this monitoring can impact their care? And I will come back to you, Dr. Prasoon, for this question.
I think, again, it comes down to, as mentioned before, the daily weight. And what you're really looking for is fluctuations in that weight. And by tracking it, you're able to monitor it. In today's world, with all the technology that's available, there are a lot of resources such as the smartwatches, et cetera. If you have those things that can monitor heart rate, they can check blood pressure, and really keeping track of that and then sharing that with your provider. Again, I think those are key elements to monitoring and to continue to look at your activity. It's important to remain active, pay attention to your diet. I often have talked to patients and I say, it's not to say that you can never have that bratwurst again, but we have to look at the balance overall. If you're eating bratwurst and potato chips and et cetera, then that can contribute to fluid retention. And so I think it's a matter of really paying attention to your diet, your activity, and at the end of the day, really taking time for yourself and managing stress. I think the pandemic has reflected that people are more stressed, and we hear about that more. But I think ultimately, for that really good self-management, it's creating that balance in your life of managing the stress, staying active, watching the diet, and really monitoring those signs and symptoms and that personal care, taking medications as prescribed. And sometimes that's a challenge, and a support person is often very helpful in helping to maintain that. So, caregivers are wonderful in assisting with that.
Absolutely. And the caregivers play a very important role here as well in helping the patients to, to manage their condition and manage their care. I would like to go to Professor Jankowska and see if she has anything to add in terms of self-management and how monitoring can impact the patient's care.
I fully agree what already has been said, that the simple measures like body weight, blood pressure, heart rate, measuring whether there are any features of congestions are critical here. Something that I would like also emphasize, it's very important to, let's say, monitor or report or to be aware if all recommended treatments have been taken. This is also something, in my opinion, very important, that patients should be aware that about the concept of compliance, which I think is very important and needs to be taken into consideration.
Absolutely. That's why we will talk about the patient responsibilities a little bit later. But we have a few minutes left in this great discussion, taking the perspective from the clinicians, from the nurses, and from the cardiologist specialists on optimal care pathway. But there is the last point I want to talk is about shared decision making. So I will come back to you, Professor Jankowska. How do you think the shared decision making can improve patients' care pathway?
I think that in the current era, the final decision about the implementation of treatment, either these are drugs, devices, or more complicated surgical or invasive procedures, should be in the hands of the patient himself or herself and their close people, family members, friends. Because I'm also a geriatrician, and one of the major rules that we need to comply treating elderly people is to listen them, to, let's say, prioritize their needs, their opinion. And I think the same is in patients with heart failure, where that's why increasing awareness with the patients regarding the treatment, considering as the person number one in the system, considering even not as the partners, because they are much more important than us in this hierarchy of people which may influence the decisions, should be set up in that way.
Now we'll come back to Dr. Prasoon. So shared decision making, how it can improve patients' care pathway? What is your outlook on that from your experience?
I believe the shared decision-making is critically important. And as stated, the patient is really the first and foremost important piece of that conversation. But I think through increased awareness and understanding of treatment options allows them to make informed decisions. And so I think it's important that individuals, patients, and caregivers both have a full appreciation of what the recommendations are, and then they're able to make that informed decision based upon that information.
Great. Thank you very much for such a great point from the importance of the self-management, for patients being responsible, up to playing an active role in shared decision-making with the patient's multidisciplinary team. Thank you, Professor Jankowska and Dr. Prasoon, for sharing your expertise. And I would like to now move to the lived experience. I would like to ask Dr. Coate to join me where she will tell her extraordinary story and what motivated her to seek change in heart failure care. Hello, Dr. Coate.
Hello, Aiste. How are you doing today?
Very good. Very glad to have you here. Would you please tell us about your story, about your heart failure journey, from the symptom awareness to diagnosis, and how are you today?
Well, first of all, I'm doing well today. So far at this point in my journey, things are doing well. I was diagnosed at the age of 27 after a prolonged illness, probably about 3 weeks of what we thought was pneumonia, and or what my doctors, the 3 different doctors that I saw, was pneumonia. And I had breathlessness, I couldn't breathe, all of the symptoms that Dr. Prasoon and Dr. Jankowska were talking about, and I couldn't lay back. any of that. And it took quite some time before we realized that I was, in fact, in acute heart failure, so end-stage heart failure. And at the time when I was diagnosed, I didn't really realize what heart failure was or what it meant. But quite honestly, I was relieved that somebody knew what to do at that point. So following a hospitalization, a 10-day hospitalization, I was well managed at that point with medications at the time. This was 17 years ago. So if any message that any of our patients, people with lived experience watching right now, is that 17 years post heart failure diagnosis, I'm still here. And so over the course of these 17 years, it has been quite a journey, and it would take me a very long time to really give you all of the details, but I was medically managed for a period of time through which I slowly declined, and then I ended up on a left ventricular assist device, which I know you are very familiar with, Aiste. And then I was on that for 7 months before I had a heart transplant, and this was in 2014. And then following my heart transplant, I was well for another couple of years. And then I started having severe chest pain, which was diagnosed as coronary vasospasm. And then a year following that, I rejected my first donor heart. I had a heart attack, was hospitalized, and discovered that I was full of rejection. And so in January of 2018, almost 5 years ago, almost close to the day, another couple of months, I had my second transplant. And I can tell you right now, everything is going really well.
Oh, I'm very glad to hear your story. It's such an extraordinary going through so much of experience as a patient, having these ups and downs, and that all the patients they experience. But myself being a patient and hearing other patients sharing their stories is just so inspiring at the same time. And it's just so I feel such an empathy for you for going through that. And I support you, and I'm very happy you're doing well now. Tell me, in your experience, what was the most difficult part of your heart failure journey?
I think feeling I'm not going to downplay, it was all challenging. But the most difficult part, I think, was feeling like I was alone in the journey. Being somebody who was younger, thinking, okay, isn't this the disease for the elderly? That part was really, really difficult. And any time that my symptoms changed, or I declined, or something changed. So, and as my story, my journey obviously states, there was a lot of disruptive aspects. And so every time that happened, you feel like you have to start over again with respect to building up your mental resilience, getting used to the medication changes, getting used to any other kinds of lifestyle adaptations that you have to make. The LVAD, for example, was a completely new experience, as has been transplant. And so anytime something changes, and feeling like you're alone, and having to adjust mentally to all of those different changes, I think that's what's hardest for me.
I can relate to your story in a sense, and I think when we speak to the patients, we do hear that they feel alone, they feel misunderstood in a way. I could definitely relate to that part. But it's the life. It's this, as you mentioned, the resilience that we need to build within ourselves, and I think that's importance of the caregivers and that closest person closest family or a loved one being around, that's very important as well, who gives a little help and a little hand towards us. Would you tell me how your life has changed since the diagnosis? Obviously, it has been a very long journey, very extraordinary one. Now you're living with a second transplant, and I know you're doing such a great work. You're a very busy woman. Tell me how it changed.
At the time of my diagnosis, getting sick and my diagnosis, it completely changed the trajectory of my life. In that, in one way, in a couple ways it didn't, but in other ways it was really significant. Being only 27, you have your whole life ahead of you, and you have this plan in your mind of what you think your life is going to be. And you realize very quickly that that's not going to happen. That what you think your life is, or what you think your life is going to be, is just you have to rethink everything. And so it was very challenging at the time, but also my husband and my life partner Nick was also just very determined to keep me going, right, and to keep me going. And so I was on the path to do my PhD, and I continued on with that work because it was extremely important to me. And quite honestly, it was the only thing that that didn't really involve any kind of physiological anything. I could do it with my brain, and my brain was still, at that point, was still relatively functioning. And so I managed to work my way through that. But in terms of thinking about, well, are we going to have a family? All of these things. That part did change. But in all honesty, with the negative or the bad parts of what happened, I have now found an absolutely incredible community that I otherwise would have never been exposed to. I'm sitting here, yes, in my office. I'd rather be with you all, but talking with you, I stay, with the Global Heart Hub, with Marilyn and Iwa and everybody. And so there is a lot of positive things that have happened as well. And so, yeah.
Very grateful for your honest answer, and really can relate to that. For me, and since the beginning, like I was doing the patient advocacy since the diagnosis, I never knew what was actually bringing me forward, why I have that fire in myself. And then I was sat down and I was just like, you know what, I just want to see what happens if I don't give up. And that really light to me to see, what we can do with the power, with the experience, with the knowledge that we have. And I think we can do a lot. And my next question is talking about the patient advocacy, because I mentioned previously that you're very active. How did you decide to become a patient advocate?
Oh, that's a great question. And I think it actually stems just from what you were talking about, that, you have this fire inside, and you have to, I think maybe some of it is you have to find a reason for why this happened, and you realize quickly that there is no reason, that it just is, but that you can help other people who hopefully have a better experience of this condition if they have to have it at all. And so that's what has really driven me forward initially, was that there has to be a better way. There has to be a better experience for patients, but also especially now that I've had not one but two transplants, and knowing what it's taken to keep me alive all of these years. I work very hard to honor my donor and my donor families, to honor the sacrifice of my husband and that of my care team, and all of that, recognizing that it's not just my journey, that it's our journey, that is really what lights the fire within for me.
Absolutely. I have the last question for you. This wonderful conversation we are having. Hopefully we can discuss more in the Q&A session. But from someone who has lived experience and who is a patient advocate, and from that perspective, what do you think are the unmet needs in a heart failure patient's care pathway? And I think that's very important. It's today's topic, and it's important to discuss.
Yeah.
What do you think from the other side, as we had in the previous, from the clinicians we heard?
Absolutely. Again, a really brilliant question. I think there's probably the biggest one, because the others have very good points about medically what some of those unmet needs are, in terms of timing of diagnosis, timing of treatment, monitoring of symptoms. But as a patient, as a person with lived experience, one of the greatest unmet needs is that of community and psychosocial support. And when somebody is depressed or you're feeling alone, the trajectory for any condition isn't good, right? It will contribute to how you feel mentally and emotionally, is going to contribute to poorer outcomes, and the research literature does show that. And so what I think people need to do, and what I would encourage people to do, is find community wherever that is, however you define yourself. We have an incredible community through the Global Heart Hub. So wherever you are, whatever country you're in, you can connect with an organization, even online support groups, Facebook groups, wherever they are. Heart Life, we have a few different groups associated with Heart Life in Canada. And so finding that community, even just to hear other people's stories, to read other people's stories, and to recognize yourself in those stories, in that struggle, and that's where it starts. And then you can reach out for help and that kind of thing. And so that part is really probably one of the biggest pieces that, as a person with lived experience, I think is an unmet need, but also a piece of advice that I would encourage others to follow.
Absolutely, such a good piece of advice for the community, for the patients, for the caregivers as well. That it really changes the perspective when you speak to somebody who has been through the very similar story, through the very similar experience, and actually even sharing the recommendations, or supporting each other, saying, I know what you've been through, and I'm here to listen to you. It means a lot. Thank you very much, Dr. Code, for such impactful, hopeful, and motivating conversation, and for sharing your stories. Knowing that we talked about the patient responsibilities, on June 15 this year, Global Heart Hub has launched an international heart failure patient and caregiver charter, which originated from the Heart Life Canadian Patient Charter and was adapted by Global Heart Hub for international communities. The viewers can find the international charter in this platform at the resources section for download, or on www.globalhearthub.org website. The charter was created by the patients and caregivers across the globe and has been endorsed by 32 Global Heart Hub Heart Failure Patient Council affiliates. This document has been translated into 16 languages across the Americas, Europe, Middle East, and Australia. The charter outlines the patients' and caregivers' expectations and responsibilities, and is dedicated to patients, caregivers, including family members and loved ones, healthcare professionals and healthcare providers, policymakers, and payers. Dr. Code, as a HeartLife Canada is a founder of the Canadian Patient Charter, let's talk about what inspired HeartLife Canada to create the Patient and Caregiver Charter, how the idea came.
Well, the idea really came from a desire to first capture what the experience of a person with somebody living with heart failure and their family carers, to really capture that experience from our perspective. So we initiated developing our a patient journey from our, from the person with lived experience perspective. And so through that, as you had talked about earlier, I say is that, we are hearing a lot of the same things across many groups about unmet needs, challenges with care, access. And so for us to then take the patient journey and translate it into some kind of document that we can then take to policymakers here in Canada, in each of our different provinces, but also nationally, to hopefully make change and to hopefully drive the change in how care is given, but also how care is received and the responsibility that is really on all of us in order to make this happen. And so my partner, Mark Baines and I, we really then came together, gathered all of our information, and the charter itself was born.
That is such a great piece. And, myself being a patient, seeing a document created like that, I was like, thank you for speaking for all of us in a sense and putting it on paper. But tell me, what are the HeartLife Canada best practices to use the charter? What have you reached already?
Well, first, it's I have to say it's incredibly moving for me to hear you speak about how Global Heart Hub has taken the charter and translated it and encouraged its endorsement across so many countries and organizations. I think it was created really as a document for all of us to coalesce around, right? For people in their respective communities to come together and say, yes, I do see myself. I do see how these issues have come to light, or these are the issues that I am having. From the carer perspective, but also from the physician perspective and the nursing perspective, as well as the patient perspective. What we are doing now is actually our next phase is to actually translate these statements, this overall charter into policy levers, right? So how can we take, the first item on that particular, on our charter, and then translate it into say, well, here policymakers, here are some things that can be done. And here is the research behind how and why that can actually happen. And so that's how we are taking it to the next level here in Canada. So we will have a report likely released in February that then takes the charter to that next policy lever, policy change level. But the first best practice, I would say, is what Global Heart Hub is absolutely doing right now, is providing opportunity for patient groups in whatever shape they come in to come around and say, yes, okay, this is a document that we can get behind. How do we localize it? Does this reflect our local community? And then how can we take it to the next level?
Absolutely. We have some great examples already happening on the ground with the Global Heart Hub. Thank you, Dr. Code, of explaining what can be done with the patient and caregiver charter. Internationally, we already are seeing some great examples of the change on the country level, where Global Heart Hub patient organization affiliates do become, as we call, a champion of leading the localization of the national level and making the impact on the awareness, education, or even access to care. And at the moment, we have full localization in Australia, United States, Brazil, and Lithuania as well. And actually, Dr. Marilyn Persoon and her organization, Heart Failure Patient Foundation, is the one organization which took the international patient chart and localized it for United States. So, Dr. Persoon, would you just give us what are the best practices and your probably big goals, what you're planning to do with the patient charter in the United States?
Absolutely. And again, thank you, Dr. Code, because this, I really do believe, is having a tremendous impact. Initially, what we did was the American Association of Heart Failure Nurses has an annual meeting, and the charter was released at the meeting and was announced to all the membership. It has since been sent to all the members of the American Association of Heart Failure Nurses, who have since used it and are disseminating it through hospitals and clinics and where they work. We have requested that they share that with primary care and their colleagues. We have also posted it on our website. We have what is called Together in Heart Failure, which is our patient educational site for the Heart Failure Patient Foundation. And that is listed in one of the resources for this meeting today, but we have the charter posted there, as well as other educational literature. But our future goal is really to work to move it out further beyond just the providers, because it really needs to get in the hands of the patients and caregivers. And so working to push it out to support groups and other communities, church organizations, and get it out to the actual individuals where it is intended, the actual patients. So that is something that we're currently working on as our next phase of pushing and disseminating it further.
A lot of great work, and I can see Dr. Code is smiling and she's happy about the work that what is being done. I could definitely share more of what has been done by other affiliates in other countries, but we actually have a few minutes and we still need to go to Q&A session, and that's what I will do at this moment, unfortunately. I have a few questions, but I do have actually one long question, so please bear with me in reading it. But I think it's a very important question and very useful for the patients. And I will ask both of you to kind of give your perspective and your expertise on that. So the question sounds like: doctors mentioned the importance of controlling your symptoms and reaching out for help if something changes, as well as the importance of shared decision-making. But many times you visit different specialists and doctors during a heart failure journey. What would the panel advise to the patients with heart failure who are starting or in the middle of their heart failure pathway to make that pathway easier? And maybe I will start now with Dr. Persoon with this question.
I concur. That is a very important question, because ultimately, whenever patients have heart failure, you are seeing more than just one provider. And this is where I think, depending upon where you live, the care may vary as far as your team and your process for communicating with your team. Being in the United States, we have several what is called nurse-led heart failure programs, or we have nurse coordinators that help to facilitate that communication. I would suggest starting with them first, because they're in a key position. If you're in a country that has a nurse coordinator or a nurse navigator, as sometimes they're called, or a nurse-led program as part of the team, that individual is the individual that is in a key position to make connections with what provider based upon your symptoms. If you're having a heart rhythm, maybe it's talking to the electrophysiologist, or if it is shortness of breath, it may be a matter of adjusting a diuretic. So depending upon what it is, that would be the first person that I would contact. If you're in a situation where that is not the case, then the individual to contact would be your cardiologist or your cardiology team, because that's who is managing your heart failure. That would be the first person. But again, it is a challenge because you have a lot of players, and on the other side of that point is the importance of providers communicating one with another, so everyone, that team, is all on the same page with regards to management.
Absolutely. Such a great point. Dr. Code, we would like to hear your perspective on that. How to make it easier for the pathway.
Indeed. I used to say, and I don't say it as much anymore, but I used to say I have as many doctors and physicians and nurses as I do as a deck of cards, because there were so many specialists that I was seeing and I'm still seeing. The one thing that I have learned is that as annoying as it is, every time you see somebody new, you have to tell your whole story again. And I know yeah, she's nodding. Is it yes? We do have to do that. But one thing that I have learned is that is actually important to do, because when you see somebody new, they might pick up on something that somebody else didn't, and all of these little details are so very important, and the heart failure can be very subtle at times, and so it is really important to do that. Marilyn was just talking about all the different players. You have to think of yourself as the coach, and they are your team, and so they're going to take a lot of guidance from what you say and how you say it. And so you do need to take some responsibility. And I know it's so hard when you're a patient and you're tired and you're sick. But write it down in a journal, think of that as your playbook, and keep track of all of the symptoms and everything, and take that with you to any and every appointment. Doing that kind of thing, I think, is really important, and something that I didn't do. And I realize now that I should have. And so retelling your story, as annoying as that is important. Treating everybody on your team, from your GP to, if you're lucky to have a nurse, not everybody is fortunate enough or attached to a heart failure clinic. And so that, and then contacting the nurse is probably the first person. So if you have a nurse, any kind of nurse, contact them. And they can help be your assistant coach in this process. But yes, it's really, that part is definitely a challenge. So that's what I would suggest.
Absolutely, I could agree that. And I would definitely mention of using the potential of multidisciplinary team, they are there to help you. And I think absolutely understanding that not everyone has an access, like a full access to the team, but just use it as much as you can. And I think that everyone is there to support the patient, and, the patient there, if they're responsible, they have their own expectations, but with their responsibilities, they can definitely reach that to optimal care pathway. Unfortunately, we don't have any time for another few questions, which I really wanted to discuss. So we really need to approach the end. So I would like to thank our panel for the discussion, and I would like to express my greatest gratitude to the speakers, to the viewers, and for joining today's focus on the optimal care pathway in heart failure session. It was extremely insightful to learn more about the importance of heart failure care in patients' journey, as well as hearing the inspiring lived experience story. Thank you all, and have a great rest of the Unite Annual Summit Day. And please join the main room after this session is done. Thank you very much.